I rise in opposition to H.R. 1155, the Scrub Act, a one-way ratchet with the sole aim of prioritizing cost over benefits through reckless elimination of rules without consideration of their benefits. This legislation would shift the costs of rules from corporations to consumers while posing substantial burdens and delays to agencies, thereby undermining public health and safety. Title II of H.R. 1155 prohibits agencies from issuing a single new rule until the agency first offsets the cost of the new rule by repealing an existing rule specified by the Commission. The regulatory cut-go provisions would apply to every new agency rule, no matter how important or pressing, for every regulatory agency. For instance, any expert regulatory agency seeking to promulgate a new rule to safeguard vehicles from ignition switch failures, to keep our water clean from chemical contamination, or to protect our hospitals in the event of an outbreak of an infectious disease, would first have to eliminate an existing rule, which would trigger a new rulemaking altogether to rescind that rule, causing years in delays. Furthermore, Title II lacks any mechanism for agencies to issue emergency rules that protect the public and the environment from imminent harm. These procedures are dangerous and would tie the hands of agencies responding to public health crises, which require timely regulatory responses. Additionally, agencies are unable to simply rescind rules. Instead, the APA requires that agencies follow the same notice and comment procedures to eliminate a rule as would be required to issue the same rule in the first place. Thus, under the bill's requirements, prior to promulgating a new rule, agencies would likely need to prepare two sets of proposals, one for a new rule and one for eliminating an existing rule required by the Commission through regulatory cut-go. This process may take anywhere from a few months to several years, especially when the underlying rule involves complex issues. Lastly, the Scrub Act is a dangerous solution in search of a problem. Each branch of government already conducts effective oversight through retrospective review of agency rules, narrowing the delegations of authority to agencies, controlling agency appropriations, and conducting oversight of agency activity. Congress also has the specific authority under the Congressional Review Act to disapprove any rule that an agency proposes. Rather than meaningfully streamlining the rulemaking process, regulatory cut-go would ossify the regulatory system by causing years of delay in the rulemaking process, additional layers and burdens in the regulatory system. In total, the Scrub Act would essentially function as a chokehold on federal agency rulemaking. Therefore, we should change the name of the Scrub Act to the Scrooge Act. It delays any new action by an agency and drains agency resources and taxpayer dollars in a time of widespread budget austerity. Lastly, I would comment that imposing the same regulatory burden on a dairy farmer as is imposed on an oil producer or an oil company sounds to me like the oil companies have been having a great day with the rules around here of late if they've got to do what we require a dairy farmer to do. And with that, I will reserve the balance of my time.